Good afternoon, everyone. Good afternoon. Yes, this is a silent conference. You have to put your headphones on if you're looking at me and wondering why you can't hear me. It's great to be with all of you here at the Paris Peace Forum. I'm Raj Kumar. I'm the president and editor-in-chief at DevEx, a news organization that covers all the many issues we're talking about today here in Paris at the forum. And perhaps one of the most important ones that we've covered in the last few years has been the COVID pandemic. And there's a title in this for this session that's pretty arresting. And it's that this is the era of pandemics. It says facing the pandemic era. And I can tell you, I don't know how you found this in your own personal lives, but I can tell you that as I talk to and interview global health experts who say, well, the next pandemic will come soon. We are in this era of pandemics. Most people recoil from that idea. There's still so much trauma from the last pandemic, from the COVID-19 pandemic, that people don't really want to face the reality that the next one could already be here, right? It could be upon us in some way. But the truth is, that's the era we're in. And if we are to learn any lessons from what we've just gone through, from the horrible experience that so many millions and millions of people and families went through around the world, we have to start to face that. And we have to ask ourselves some tough questions, including about whether the global health architecture, whether all of the international organizations actually learned any lessons, whether we actually came up with ideas for what we might do differently the next time. And so we have a panel of experts who work on these issues every day to talk about precisely that. Where do we go from here when it comes to the global health architecture that we have? So let me just mention who we have here, and then we're going to dive into a conversation. First of all, I want to welcome and introduce Henry Oryem Okello, who's the Minister of State for Foreign Affairs for Uganda. Excellent to have you here, Minister. We have Stéphanie Sédou, who is the Envoy for Multilateral Affairs at the World Health Organization. So this is what you work on every day at the WHO, which is, of course, at the center of all of this. And Hatis Beton is with us, who is the Executive Director for G20 and G7 Health and Development Partnership. Great to have you here as well. And we want to just dive into this discussion. I think I have to start with you, Stéphanie, because this is your day job. You work on this every day. You think about the global health architecture. You are leading on the idea of creating a pandemic treaty of some kind. When you think about what we just went through and where we are now trying to position ourselves to be ready, what is it that the world needs to change about the global health architecture?
Well, thank you so much for the question, and a very good evening to all of you. Well, indeed, as the pandemic was still raging, it dawned on everyone that the system wasn't optimal. What happened was that emergency measures were taken as the crisis was unfolding, and as the crisis was unfolding, the realization came that the collective organization was indeed failing or wasn't enough. And the decision was made then, so again, as countries were still dealing with the crisis as it was unfolding, to take a number of measures and address the gaps. And well, I'm happy to go into them.
Well, this is when the ACT Accelerator was stood up. There was COVAX, right, which was created as one of the pillars. So I think probably people who follow this topic know something about the desire to change the architecture, as you say, very quickly in an emergency moment. It sounds like now you're thinking, and the WHO is thinking, well, we can't just rely on whatever we created for the COVID pandemic. We need to think about the broader architecture in this new era of pandemics.
Well, definitely. Act A, the access to COVID tools accelerated. It was like building the ship in the middle of a tempest, right? There was a call for action in April 2020, and Act A was put together immediately, and this was to allow for equitable access, sufficient access to medicines, to vaccines, to diagnostics. Well, we were lucky enough in a way to indeed have a vaccine discovered and effective. What really failed was sufficient quantities of that vaccine being made available in the right time and efficient and equitable distribution of this vaccine to most countries. So immediately as this was unfolding, we were on the one hand, dealing with, indeed, trying to make this vaccine as available as possible, and there was an effort. It was certainly insufficient, unsatisfactory, but there was an effort which was made collectively. Again, WHO was at the center of this ACT-A mechanism, but there was the recognition that this wasn't enough. It was an emergency response. What we now need is a peacetime construction which will be available when, as you say yourself, the next pandemic strikes, which could be any time.
Right. I mean, I just came off of a panel with Prime Minister Mia Mottley where we're talking about the health and climate nexus and how as the climate changes, we're likely to see many more infectious diseases that we maybe can't predict now, including fungal infections, right? So we need to be ready for that, and we need to have the architecture, as you say, not in the middle of a tempest, but while we have maybe a moment to breathe and to think about where we should go. So maybe, Hattis, I can bring you into the conversation on this point, because you work with the G7 and the G20, you think about the multilateral agencies and how governments can partner. What do you want to see them do when it comes to the pandemic agreement or any other health system architecture change you think is needed?
Yeah, thank you. It's a pleasure to be here with you, Minister, and Stephanie here today. If you allow me a few seconds, Raj, I would like to take stock actually what has been achieved since 2017 before we go to the next further planning round of discussions here. Because in 2017, as you can hear from my accent, I'm from Germany, my Chancellor, Angela Merkel, has created the first health ministers meeting in the G20. And even back then, there was an attempt by all health ministers to do a pandemic simulation exercise. Many people may have forgotten about this. And actually, one of the health ministers is here with us here today, Agnès Buzyn, former French health minister. She was at that very room, and she was telling me a few minutes ago that when they did this simulation exercise, all health ministers have agreed to comply with the international health regulations. So fast forward, of course, when a crisis happens, these regulations weren't really complied with. And that's why we are talking about a pandemic agreement right now.
And this includes things like, you know, who's going to have access to the vaccines. And so we had the least at-risk populations in the richest countries getting the vaccine before older people who were most at risk in lower-income countries, for example.
Exactly. And if you think fast forward, first of all, what leaders have to do, and we will come to that in a minute with G20, G7, but I think not only just looking at the vaccines, therapeutics, and the tests, but strengthening the health systems, strengthening primary health care systems, building universal health coverage, and giving countries more the responsibility and authority to put money into building their health systems will be very crucial to also work on preparing or preventing a next pandemic, of which we have enough, as you said, with emerging, ongoing wars that we have, demographic changes, but also the emerging climate change challenges, malaria, dengue, TB, will be all on the agenda of the G20 next year as well.
Yeah, that's exactly right. The environment is changing very quickly around us as we have this conversation. Minister, I want to come to you on this issue of what was your experience like in Uganda during the pandemic, your kind of personal, the country's experience, and what lessons are you taking from that as you think about how we prepare for this era of pandemics?
Well, first of all, I'm glad to be. I'll give you the political view. I'm not a physician or a doctor, but how we manage it in Uganda. First of all, the word pandemic was something which is alien to literally the whole community or the whole country. What is a pandemic, really? And so when COVID started, we started watching what was happening on television in other countries to people to realize that there's some serious disease or something which is going around the world, but people didn't absorb really what the pandemic was. And even the medical infrastructure as such in Uganda and probably other parts of Africa did not appreciate what or how to handle what a pandemic was. So when it finally came to our region, we had seen a lot of what's happening in other places. We had seen how they respond in other places, but our health system, our infrastructures, and even the financing of the pandemic or handled wasn't there. So what immediately our president decided to do is convert the whole thing into a national security issue. And he took charge of the leadership of how to handle this matter and said, this is a war, and I'll take the leadership in this war. And in consultation with other head of states, consultation with WHO and those who had already got the pandemic and going through it, he started having a weekly or bi-weekly television address on what measures individuals should take, because we didn't have the vaccines, we didn't have the basics, and we didn't have knowing what we're dealing with. So by him giving and addressing the nation on a weekly basis, that these are the preventive measures we have to do. We don't have the medicines, but the first steps we should do is wash hands, if there's sanitization, isolation, and so on and so forth. And emphasizing and emphasizing and emphasizing. Now, because he said this is a war, the whole nation would sit around the television at 8 o'clock on a Thursday and would have to be glued to hear what the president is saying. And everybody knew that if they didn't follow what the president is saying, then they're doomed. And that is the initial steps, thanks to his leadership, that helped prevent what would have been a very serious situation. By the time we got access to the medicines, and by the time we got and the vaccines, it was now an additional on what the president has started as steps towards primary health, precautions, and so on and so forth, towards what we didn't know initially. So, but unfortunately, again, when the vaccines came, we didn't get it immediately. There was a lot of vaccines somewhere, and the selfishness by other countries, be selfishness, and the total denial of us in Africa getting access to these vaccines, and unfortunately, it became politicized as well. Politics came into it, and to be fair, the first call of first vaccines we had was something called Sputnik, the Russians. The Russians were fast to bring in Sputnik. The Chinese came in with their version of the vaccines. And later, the known names came in much later when the other countries had realized that, hey, the Chinese are coming in, the Russians are coming in, we should be there. But initially, they didn't want to come there. And also, initially, it was preventive measures, political leadership, and later on, vaccines which we didn't know about, or what it contained, which was brought to save us.
Well, and you brought up an important point, Minister, which is it's not just the vaccines. They get a lot of attention, but even basic things like hand washing are so key when you think of infection control in this era of pandemics. You know, will hospitals, will primary healthcare clinics have the basic equipment that they need? I think that's another key component of the conversation. And Stephanie, just coming back to you, we have a global health architecture already. It reflects, maybe to the minister's word of politics, it reflects the political reality. There's been support for vertical funds. So we have funds around specific disease areas like malaria and HIV. We have different public-private partnerships, Gavi on vaccines, for example. And of course, we have the WHO. Is the architecture as it exists now what we need for the era of pandemics? And we just need people to agree to fund the current architecture? Or do we need some new architecture? Do we need to take ACT-A and COVAX and facilities like that and turn them into institutions? Or what is your vision for what the world looks like in a new era where we have a pandemic accord and we have this new, more modernized global health architecture?
Well, clearly, we can see that what exists provided a very important basis for a lot of the response. In very many countries, what was already embedded in the country in terms of the fight against tuberculosis in particular, another respiratory disease, or HIV with community centers, etc., helped a lot to put in place some of the preventive measures for COVID. So that worked to a certain extent. But again, it was what we had on the ground at the time, and if it had to be built for purpose for a pandemic, maybe things would be slightly different. Now, nobody's saying that one should do away all of a sudden with a lot of these, with those institutions which are performing, which have their place. What is needed really is for this whole discussion to now take place as to what is the right way to do things. And can I get back to what Hatice was saying? And indeed, what we had until the pandemic hit, what we had and still have is the international health regulations, which is a legally binding instrument by which states, so governments, agree to certain measures such as surveillance, risk assessment, and capacity really to deal with epidemics and possibly pandemics, and to share information. And all of this is done at national level with WHO as the curator of that system. And that indeed, important point, in a way which is balanced with the necessities of traveling. So what member states put together is a commitment to monitor and share information about any events of concern in terms of spread of pathogens, but to do so also in a way which is respectful of other constraints.
Right,
and
that's the big risk is if you share information that, hey, we see something in our country, will all of the other countries shut you down?
And that's what happened with South Africa when they respected the IHR and came up with the Omicron variant. So we know that's the way it can work. What we didn't have is another structure to put in common, because you said the sharing of the vaccines, well, that was nowhere. There wasn't a framework until 2000, when the pandemic hit in 2020, there wasn't a framework for sharing and putting in common the questions of, indeed, enough information on the pathogens, enough information on the countermeasures, so countermeasures are treatments, diagnostics, vaccines, and any other necessities, oxygens, protective equipment, etc. And on the viruses, on the countermeasures, and on the information. And that is the space that we didn't have in the global health architecture, is a place to discuss how to put in common the right ways to deal with those necessities which this pandemic made obvious we needed. And so this is what is at stake in this really crucial negotiation about the Accord Treaty instrument for, so as Hatice said, prevention, obviously best to prevent, preparation for, you prepare during peacetime, and response if that is what is needed. And this is what is being discussed right now.
Let's continue on this discussion of the pandemic accord or treaty. Hatice, you can take us further on it. We're at the Paris Peace Forum. So, of course, we're focused on the fact that there is a lot of conflict in the world. There is a huge rivalry happening among many great powers in the world. And yet, we are asking as a global health community for them all to come together and to agree. And that's hard. And maybe not just agree on terms for what to do, but also increase funding for prevention and for response. How do you think this negotiation is going, Hatice? And what are the chances we can actually get there? What would we need to do to get to this new place we want to go as a global health community?
Thank you, Rush. I think, as you outlined, so we are going through a major turmoil in geopolitics. It's Zeitenwende, how we call it now these days. And we need to realize that whatever health challenges we want to finance or tackle in the next few years, we can't look at it in silos, right? We have to look into, if we are tackling X health emergency on malaria, how is it interlinked with climate change? So we have to bring in dialogue the health ministers with the environment ministers and even the agriculture ministers. If I look at antimicrobial resistance, for example, this is looking at the One Health approach. This cannot only be solved by health ministers alone. It's a matter for many other ministers, including finance ministers. And since our foundation in 2017, we have actively worked on bringing health and finance ministers to the dialogue to look into new ways of financing the common global health challenges that are affected by other ongoing challenges. To your point, I think what we will see in the next year or next 2 years, when the first ever G20 cycle will finish with South Africa, is convergence, but also competing for funding. And I think our politicians have to be mindful of that and try to create more convergence in these multilateral fora when it comes to financing or working on common challenges, rather than competing amongst funds. We know that ODA and replenishments are not the solution for the future to tackle the global health financing crisis. We only have achieved 12% of the SDGs. We have 7 more years to go. So everyone knows that in this room. So I think, coming back to your point, what I would expect from Brazil and Italy in the G7 next year would be stronger convergence, alignment between their agendas. Obviously not losing focus on pandemic preparedness and response, but looking at it from an investment point of view as well, because what is the cost of not investing now? And I think that's very crucial, because it's, if I may say bluntly, it's not a sexy topic anymore to talk about pandemic preparedness.
Everybody wants to forget it happened, right? And assume we can wait till the next pandemic, then it'll become an issue.
Exactly, and we need to remind them that now we need to build the health systems, and why, and what's the impact. If we put money, let's say the pandemic fund, right, X money put into strengthening health systems or educating healthcare workers can create this amount of return or impact on the society, increases productivity levels, and also boosts investor confidence in the country as well. So it's how we tell the story. And last but not least, I want to remind everyone, during the pandemic, apart from countries, actually when you speak to investors and asset managers, there was an 11-fold increase of investment from the private sector. So they were not ignorant to this, but they told us in a recent study we have conducted that they couldn't find the right channels to whom to talk to create these public-private partnerships of blended finance mechanisms. So we have all these mechanisms there. It is political will, creating the linkages, being realistic that health is not the sexy topic in the room anymore, but still make sure that we don't lose sight of it in the whole geopolitical framework.
Minister, you brought up the word politics, and now we're just talking about politics. So let's keep going on that theme if we can for a second. And I mentioned to the people listening that we will try to go to questions. So start thinking if you have something you want to provoke in the discussion. You get to be in the room where it happens, right? You get to be there. We had a high-level meeting at the UN on pandemic preparedness and prevention and response. We now have a pandemic fund. DevEx has covered the fund, and I believe in the first round of grants, Uganda didn't get a grant, but hopefully in a future round, you might. It's about a $2 billion fund today housed at the World Bank. We are now negotiating this pandemic accord or treaty. From your impression in the meetings you have with your counterparts in other governments, is there energy, is there enthusiasm for this agenda around a pandemic treaty and around funding for pandemics? Or has it, to Hatisha's point, kind of been put on the back burner?
I think there is a political pandemic, so to say, also, because the priorities of survival, human survival, seems not to be on the mind of politicians. Because we're talking about human survivals here. When the pandemic hits, if it's not addressed, you're talking about, in the case of COVID-19, millions of people died. But when you have now wars breaking out in the world, the amount of money that is spent in buying arms is so colossal that it's mind-blowing. 40 billion, 30 billion, then next thing we need another billion, then next thing we need another billions. I mean, if that kind of billions would be put into health, and if that kind of billions could be put into the preparations and creating awareness, and for the next pandemic, if it comes, I'm sure we'll be having this discussion here. But the politicians look at their constituencies. The politicians look at the next elections for survival. The politicians do not care about anything but how will I be elected or how will I be re-elected. So when we talk of lessons that have to be learned from this pandemic, I think there are very few political leaders who will put their money in that kind of preparedness. I think they are diverted into seeking re-elections, they diverted into protecting the positions, and this is very, very unfortunate. I mean, COVID-19 in our generation, in our lifetime, is a shocker. I never thought, I'm 62, I might not look at 62, but I'm 62. And it is, I never thought in my lifetime there'll be a pandemic. I've read about it, I've seen movies about it, but I never thought it'll happen, and it happened. The next one will be worse. The next one will be catastrophic. It'll be beyond what we can manage. Then what? So, but if we start prepared, as I said, there's no one formula, there's no one response mechanism, but if we have the basics in place and we put the money, the basics in place, that would be fantastic. There's something called the Abuja Accord, which requires that governments should put 15% of their GDP towards the health system, the health systems. But how many countries did even reach half of that? We have something called SDGs that we have to achieve in a few years. But how many countries, I'm sure the next pandemic will be here before we even achieve the next SDGs. So we need, I do not know what to tell the politicians out there, but there is, but maybe we should talk to electorates that, and we also politicize this and say that those governments, those political leaders that do not put the money towards preparations and preventiveness of the next pandemic should be elected, then probably they'll wake up.
It's almost like more than a health systems architecture change, we need a development finance change, right? We need a new way of financing these issues. But go ahead, Hatice, you wanted to join.
Yeah, just on the political electoral cycles, as you say, Minister, if your health minister would go to your president now and ask for more health budget, he would shut the door to him because he has spent so much money in the last few years, right? So that's the reality we're dealing with. What we need to look into, and that's to the minister's point, is how can we, as Prime Minister Mia Mottley was saying today as well, according to her Bridgetown initiative, for example, how can we restructure that? Half of the world's population, 50% of countries are trying to service their debt right now. So there is no money and budgets to structurally put into health investments. So that's the reality. So how can we change loan conditionalities, maybe extend them? Or how can the classic Bretton Woods institutions reform themselves to give certain countries these conditionalities, like health for debt swaps or other mechanisms that are out there, or sometimes even writing off some debt, and I'm sure that's possible as such for some countries. So I think that's one thing the world stage has to look into in the multilateral fora in the next few years.
Stephanie, will we get this pandemic agreement? Is it going to happen?
Oh, absolutely, because the minister's right in, well, touching upon the motivation of politicians. I do get that maybe right now there's a tendency to want to completely swap to something else. But, I mean, in the political lifetime of many of these politicians, it will strike back. So this is a certainty. They might have to actually answer to their electorate in 2 years' time if responsibilities have not been taken now. And the pandemic accord is due to be signed in May. It's possible. Dr. Tedros has said it at the opening of the last round of negotiation. What it does take is focus on the issues, sit around a table, put things on the table. Nobody will get everything they want, but if everybody doesn't give a little bit, nobody will have anything. And that means ensuring that instead of picturing this as a either or on the three of the main issues, which are access to equitable access to medicines versus innovation, protecting health policies versus fair profit, national or regional interests versus global collective security, all of this can be actually brought together. It doesn't have to be a zero-sum game. What it does take is for people to sit down, diplomats, experts, with good leadership from the leaders saying, make it work. If that is what happens, if that happens, and it can, with patience, with spirit of compromise, we get an agreement, and the leaders won't have to bow down their heads in shame to their electorate in 6 months or in 12, when again we have a huge disaster coming, because we will have mitigated the risk with this agreement.
And there's just a huge advantage to doing this all in advance of a crisis. I look at some of maybe the lessons we're starting to see from other institutions. It could be kind of a model. You look at the Green Climate Fund, you look at the Loss and Damage Fund that's now been set up, you look at the Pandemic Fund, all relatively modest and small at their start, but they create a window so that you can then have a political conversation to say, well, here is something to actually go and put money into. And so it's disappointing when you get a loss and damage fund that basically has no money. It's just a vehicle. But it gives us the promise that as you change the situation, you might be able to get funding there. I'm looking at our audience to see if anyone has a question or an intervention. I see a few hands. We'll take all of your points at once, and then we'll come back. So is there a microphone to go around? Is there a microphone? Yeah? Right here in the front. Yeah, we can hear you. Go ahead. We can hear you.
Can you hear me? Oops. Thank you. Casimiro Vizzini from the One Sustainable Health for All Foundation. It was interesting that you mentioned One Health before, and you mentioned the Ministry of Health and Environment, but I think there's something missing, that is education. We need to change mindset, and to change mindset, because it's hard to start from the top. We need to start from childhood and research and basic sciences to transform the approach into a One Health approach. So then it will be easy for ministers to work together when their mentality has been moved into this direction. Thank you.
Yeah, great point. We can pass the mic. We'll take a couple of more there in the back. Yep.
Great, thank you, and thank you for a great panel. My name is Colby Wilkeson from the Broad Institute. My question is, I think COVID was the first time we saw on a global scale the impact that the pandemic had not only on our lives, but the economy, education, even other health silos like vaccine access in different countries. But we also see this at a smaller scale. If we have an anthrax outbreak in a small community, many animals are slaughtered. That impacts the food industry as well as people making money. How are you seeing, I don't know if it's a change in rhetoric or even just the introduction of this rhetoric in the global health architecture, and maybe specifically in the pandemic treaty? Are there ways that the work that you're doing can support politicians and policymakers weigh the risk of locking down your entire country versus having an increased threat of a pandemic? And how can we more proactively support policymakers who have to take in all of these different risks and weigh them when they're making those decisions that impact their community? Thank you.
Thank you. And we'll take one more behind, if you can pass the mic there.
Hi, Michael Garnier-Lavray from the French Ministry of Health. I'm the G7 and G20 Sherpa in the health track. I just want to make a comment. It's easy to be pessimistic, and I think it's harder to be optimistic. But the situation can be also seen as optimistic in my point of view. Since 3 years, we are hundreds of people who are working towards the issue you mentioned. We try to reach consensus in different areas, especially in the governance, but also in the finance and also in the tools. You can say it takes time, of course, but we had made a lot of reports. Then we had discussion in G7, G20, at WHO, in UNGA, and then to reach a consensus and not a majority-minority staff, it's difficult. So you can see steps. You mentioned the Pandemic Fund, it's a good step. The Finance and Health Task Force, with a lot of work since 2 years. You have also the way that we craft the discussion around local producing in Africa, but not only in Africa. So step by step, we try to reach consensus again. To move on, we need a political will, of course, but we need also to move from every stakeholder, to be honest. From the global south, from the global north, from the industry and others. And 2024 is a key moment. We had a report in 2021, in 2022. We had a lot of discussion in 2023, and we aligned the discussion in G7, G20, and also with the Uganda meeting. Now it's time to go further with the equity at heart and try to align and not to fragment it again. We need will, we need support, but we need also to be optimistic. We have 1 year to go, and I think we can achieve something with everybody on board together. Thank you.
I think that's an important message, Mikhail. I appreciate that. You have someone who agrees with you, Stefani, that we are going to get there, and we need that, especially in our Sherpas and in people who are leading those negotiations. But it sounds like one of the things Mikhail is saying is that it can't just be people like yourselves. This needs to be all stakeholders. Are you seeing that? Are you seeing the private sector, whether it's in the health community, the civil society organizations, many of the other institutions that make up the space? Do you feel like there is a movement of all of them together, to Mikhail's point?
Movement, yes. All of them together. There's still a little time for this to happen, hopefully. Clearly, there are a lot of groups and stakeholders which are being brought in the negotiation. But let me just make this one point. Those who are negotiating are the member states of WHO, i.e. countries, governments. They will be the ones who, classic international negotiation and treaty process, they'll be signing, they'll be ratifying, and that will bind them. That being said, the other stakeholders are being associated and being informed, so NGOs, different advocacy groups, the private sector indeed, and for the for-profit private sector, science as well, academia, etc., etc. So yes, they are being brought in. And may I say, we're taking advice also from the press and from journalists. There is a climate of disinformation around this treaty, which is a little bit concerning, and where WHO is really hoping for the support of the interested international community of people of goodwill to dissipate some of the misunderstandings, which are not only casual around this treaty.
That's absolutely right. Often the misinformation is very much intentional. And you are right to point out our role as journalists. We take it seriously to try to make sure the right information gets out to people. Minister, one of the other things Mikhail brought up was local production. And it was one of the lessons from the last pandemic that not just the vaccines, but also basic face masks and other PPE equipment was having to be imported. Do you feel like that situation has improved in Uganda or in the region?
I think so, because she's right that there are many local initiatives that had to be taken. We, as I said earlier, we were expecting a catastrophe in our region. But on the other hand, we also deal with other, what I call other diseases that Western countries don't have to deal with. For example, malaria. We don't have to deal with malaria. But we have a continuous standby system and mechanisms on how to deal with malaria. We have things like Ebola, which we have to there's a continuous task force mechanisms, people trained to deal with Ebola. She was talking about anthrax. We have something called foot and mouth disease, which prevents animals moving from one region to another region, and so on and so forth. Now, these mechanisms that we have to deal with all these different diseases that are not common in the Western countries were brought into play. And that expertise, the knowledge in those areas were brought into play during the Ebola crisis, the COVID crisis, to see how it could help respond to the COVID pandemic. Because we didn't know anything else. We knew how to deal with Ebola, we knew how to deal with malaria, we knew how to deal with these other diseases. So those were the local specialities or the noble knowledge that we used to deal with this. The making of masks, the making of face shields and all those came about by young people seeing how masks were being. We could not afford what you call disposable masks. It is very expensive. So we took advantage of women's groups or young students groups to start stitching reusable masks. So you have this mask made of cloth, and you buy 2 or 3. You put on one in the morning, you wash that, and then you put the next one. So that went on and on for I think almost a year, until the disposable masks increased in number. The price went down. They started giving them free to people, and then we used that. You're talking of vitamin C. They said, do we have to take vitamin C? We have to take access to vitamin D, something called zinc. They have to be taken. Then there's some antibiotic, which has got a funny name I cannot pronounce here. I mean, we're a bit fortunate in Africa that vitamin C is not a big deal, because you can just pick your mangoes, bananas, and all these fruits all over the place. And in all sincerity, that helped a lot, because not everybody could afford. The price of vitamin C at that time had skyrocketed. We had no problem with vitamin D, because we just sit in the sun. I mean, just sit in the sun. Black skin are not the best skin to sit in the sun, but you had no choice and sit in the sun and get your vitamin D. So the local response we had people digging up ancient African herbs which they could concoct, which had to do with flu or some fever and so on, and people were drinking it. And even there's a professor who created some nose drop of his, which became so famous, and the government even gave him almost $1 million to produce that thing. And it responded so well to COVID that it became a very big hit in the region, and there's a very high demand. But these are local produced medicines, traditional cultural medicines. These are local produced responses to COVID. But of course, we need to upgrade and go to the scientific methods of dealing with these pandemics. But as it comes down to access to fund, it comes down to availability to technology, acceptability to transfer of technology, and access to getting cheap medicines or production of cheap medicines. For example, when they started hoarding the vaccines, when it became difficult for Africa to get vaccines, the immediate response of head of states was, let us get our own vaccines and start producing our own vaccines. And countries like South Africa start putting machineries and facilities, start producing their own response to this. Egypt got the Chinese to put them on facilities. My president is investing in trying to get a vaccine that can deal with build capacity, training our young people, our doctors, and other expertise on how to be able, in future, to be able to get our own vaccines if need be.
Yeah.
So there are local mechanisms that came about because of this situation.
Yeah, and I think to Colby's point, countries like yours are not just thinking about the next pandemic. You're dealing all the time with the potential for health risks.
24 hours.
Ebola was there just, 9 months ago, 10 months ago or something, right? Like, so you have to think in different terms, and maybe
I've just come back from home last week, and there was this campaign. I was listening to the radio. There's this campaign to distribute bed nets against mosquitoes for malaria. And I was listening. Is my region also getting mosquito nets? And then the Minister of Health says, "Be patient, Minister. We'll reach your constituency."
Right. So yes, we're talking about the next pandemic, but we also have to think about the reality many countries face, which is just a world of many different health risks, and being able to balance those risks all the time. We're getting near the end of our time, so I want to maybe come to you for a thought, Hatisha, which is about this issue of education and where it fits in. From our colleague at the One Health Foundation, because I think often we talk about we're going to change the energy system because of climate, we're going to re-engineer our health systems because of all the pandemic threats and others, but at the end of the day, it's people that are running and managing all of these systems, right? It's human capital. Education, I think, plays a pretty key role. What's your take on it?
Yeah. Just very quickly on the minister, I'm glad to hear about your campaigns on vitamin C and D, as long as there was no bleach in the game in some other countries, if you remember, right? So there you go, we learned a lot. Yeah, on the education system, I think the critical thing is during, I think the G20 Sherpa colleague said it before, now you have, for example, the joint health and finance ministers meeting since 2019. That was a path of education as well, because for the first time, health and finance ministers were sitting together, learning how budgets are allocated in the finance ministry. The health ministry was showing them the impact, and that led to all the creation of looking at surge financing, creating new financing mechanisms. On the One Health approach, I think education comes into play because we talk in our 30,000 feet level how we want to tackle antimicrobial resistance, but in the end of the day, we also need to bridge that gap from the bottom up, right? How do we talk to our doctors? What are the regulations? How are national action plans on OEMR efficiently implemented or not? So we need to take stock of this. This is why I think clear education campaigns have to run in all these disease areas that we're talking on today. I'm conscious of time, just two more seconds on the pandemic accord, or agreement, how it's called now. Stephanie mentioned a good point. So partnerships during the COVID pandemic have shown to us how we fastly accelerate solutions worldwide with public-private partnerships, procuring vaccines, tests, diagnostics, etc. I think with this pandemic agreement, the key thing is not to politicize it too much, as the minister referred to earlier as well, and not to create new initiatives and plethora of new communiques. I think we need to look at what we have. So the Global Pandemic Monitoring Board that does an excellent job every year assessing the risk of a pandemic, they need to be strengthened going forward in our view. And you need to have a political body that's part of the pandemic agreement that can be compiled by the European Union, the African Union, maybe ASEAN. And the regional integration of this political body can work hand in hand with the Global Pandemic Monitoring Board to assess how countries are performing on their pandemic regulations year by year to comply with the international health regulations. This could be a way forward. So we need to think, that's my last point, of the governance of this as well. And I think misinformation happens because everyone is talking, basically threatening us about what this agreement may entail or not. But actually, if we would talk about how we would govern it, it would maybe take some of the misinformation away as well.
Interesting. Well, Stephanie, you get the last word. Where do we go from here?
Okay, well, I have three asks. One is, please, for all of you interested, put the right pressure on your governments so that they sign this accord by May 2024. That is really needed. Second ask is pandemic fund working really well, only 2 billion, but leveraging up to 9. And there are countless excellent projects which have been presented, which are of a new kind. It's bottom up now. It's countries with their national plans asking for what they want, and the donors meeting that
and regional
demand.
Plans too.
And regional plans. So it's not the vertical distribution of money that doesn't always know where to go. And my third ask is, COP28 is coming up super soon. There'll be a health day where climate and health will be addressed with a declaration to be signed by, we hope, as many governments as possible. Again, this is something which fits in with the new global health architecture. Health needs to be brought into the climate negotiation. Why? Because the climate negotiation, okay, it's about saving the planet. It's about saving us. Mm-hmm. We're actually dying and becoming very sick from climate not being tackled properly.
Well, you've given us 3 calls to action, plus 1 for us journalists, which we will certainly take up. I want to thank all of you for being a part of this conversation. It's great to be here at the Paris Peace Forum. Thank you.
Thank you so much.